we are seeing an increase in cases in all 50 states. So this is not a regional surge like we probably discussed a few weeks ago. Where exactly are we in the timeline of this pandemic? I don't know where we are in the long, dark tunnel any longer.
Yeah, so let me give a little bit of good news. I mean, the fact that we have a vaccine ready and available and over half the country vaccinated means we've saved lives. So good news is that as cases are going up, we are not seeing a proportionate rise in deaths and hospitalizations. So for the vaccinated, it is incredibly safe. For the unvaccinated, however, we are definitely concerned that this is, as you point out, all 50 states. And I think what's similar and what the tunnel looks like is that we see regional kind of pockets like Florida, like Missouri, Nevada, but then that slowly over time spills over all over the country, as you point out. I honestly, a lot of us looked at modeling and thought that the fall would be this kind of climax where we had people returning to work and school and had these high cases. And now we're having to reset that. And it's all because of the Delta variant, much more infectious and much easier to transmit as a result. So our tunnel, I will say this, Zerlina, ironic as it might be, by winter, we could have had so many people either vaccinated or infected that we, in effect, kind of develop that wall of immunity or that herd immunity that we've been looking for.
But in that scenario, a lot of people die, right? Because a portion of that is people who are infected with the Delta variant. Okay. Yeah, so just it's important to all put in context, right?
Yeah, and the majority of deaths are going to be in the unvaccinated. That's right.
Gotcha. Okay, that's helpful to understand. So in terms of some of the hesitancy we're still seeing now in terms of the unvaccinated, those who still have not gotten their vaccine, there's a growing feud happening between the White House and Facebook over vaccine misinformation, which I think is a contributing factor, and the White House sees it as a contributing factor to the hesitancy we're still seeing. NBC spoke to a woman who at one point was posting anti-vaccination information on social media, but then ended up getting COVID. So then ended up getting a COVID vaccine. Let's take a listen to what she said.
We're just constantly absorbing all this misinformation. It's kind of like, oh, well, if 100 people shared that, it must be correct, but nobody actually fact checked it. So that's the danger of how fast fire spreads on Facebook.
For you, what changed? What caused the change of heart? I
felt like you had to close your eyes to not see how real COVID was. And I was just watching these people deny it. And I could not get on board with it.
What are your thoughts on the spread of vaccine misinformation? It's interesting to see that woman saw the light, but a lot of people are not, and dare I say, unfortunately, until it's too late and they come down with a serious infection.
Yeah, it's really troubling, Zerlina. In medicine, we have a concept of the number needed to harm. And in this case, one misinformation, I'll just even say these are lies. One lie can actually cost someone their life. And I think that it's not something that we could have predicted, but I'll be candid, Zerlina, we're acting way too late. I think that these 12 individuals who are responsible for such a high degree of misinformation and lies, I mean, we've been seeing that. Zerlina, you've seen it on Twitter. We've seen it on Instagram and Facebook. I can't tell you how many times we have seen dangerous TikTok videos spreading lies. But here we are now trying desperately. It's hard to put it back in. The genie can't go back in the bottle when we let it flourish for so long, even before the pandemic.
It's so true. And Dr. Fauci also commented on this idea that vaccine misinformation is impacting our handling of this pandemic. And he made an interesting point. Let's take a look at that.
Probably would still have smallpox, and we probably would still have polio in this country if we had the kind of false information that's being spread now. If we had that back decades ago, I would be certain that we'd still have polio in this country.
So do you agree with Dr. Fauci on that point? I've been thinking a lot about other viruses, both old and ones we haven't seen yet, where misinformation in this particular pandemic could affect the future in terms of old diseases coming back and us unable to handle new ones that may pop up.
I do. And sadly, Zerlina, it didn't start with COVID. I saw it when I was a medical student and we had a mumps outbreak. And in the Pacific Northwest, and it was distinctly tied to people, a kind of a core group of people who had spread information and lies about links between vaccines and not just autism, but other diseases. So there were a whole crop of people, even as early as the kind of 2000s, that have started something that unfortunately is now becoming regular. We're seeing diseases that we hadn't seen before. COVID has just made that market because it affects everyone. And I do worry. Here's the problem, though. How do we know? We don't have like a truth checker, right? There's no seal of approval to kind of say, this is a fact and this is a lie. That's really what we need. So anybody listening, even if you're just clicking and liking, stop and ask, what's the source of this information? And if I like this, I could be influencing someone else. I have to do it too. And I think we all should pause every time we get on social media.
It's so important. In terms of policies, what can the White House or the federal government do in terms of mandates or regulations around misinformation?
Yeah, I do think that there's, interestingly enough, kind of when I worked in the White House, it was kind of the advent of really Twitter taking flourish. And we talked with big tech, and I think it's still true to this day, that there are not just proprietary algorithms, but there's way that kind of the liking of something can trigger, this incredibly viral effect. And I do think there's room for regulation of that. In fact, some of the tech giants have actually asked for more scrutiny and regulation because they would like to figure out how to get to some standards. But I'll tell you, Zarlina, we don't have the luxury to waste for people to think about it from a policymaking standpoint. We need to have action now. And as I mentioned, this feels like a Band-Aid on a very large wound. We're not going to be able to do it unless we also mount a defense. And in this case, our best defense is to do everything we can to get more people vaccinated so that we can deal with this and confront the lies for the next pandemic. And the next pandemic is here. It's gun violence, mental health. It's how we're feeling about a kind of our racial tone with each other and racial equity. So we need to be able to kind of move through all the lies that we've seen in not just social media, but like with each other. The number of people that believe that Democrats are really trying to propagate some lie about this vaccine, or they're trying to push vaccines and masks on people, divided our country in ways that make me frustrated as well.
Right. I mean, I think when it comes to science, I hate it when people go, like, I don't believe in, say, climate change, for example. And I'm like, that climate change doesn't care if you don't believe in it. COVID doesn't care if you don't believe in it. Like, it exists. It is fact. So unfortunately, in this instance and context, it's very serious with, like you said, life and death consequences. Dr. Kavita Patel, thank you so much for helping us understand this week as we start the beginning of this week in July. And it feels a lot like last year in COVID-19. So hopefully we can move forward down this long, dark tunnel.